I'm Marc Sclafani. I'm a prosthodontist on the Upper East Side of Manhattan. I'm here with Rolando. I'm happy to be here. Thank you for having us.
Awesome. So good morning, good day, everyone. This is Dental Voice Season 2 with Zyris, and my name is Rolando Mia. This is Dr. Marc Sclafani. This is awesome because when you look, the purpose of Dental Voice is to hear from clinicians like Dr. Marc about their experience, what's going on, and then advice and perspective with regard to what's happening. So much has happened since COVID hit us. We've gone from, not knowing anything to thinking we know everything to shutting down, opening up. And now that we're working again, it's really important to try to figure out or hear from clinicians what's working and what's not. So, Dr. Marc, thank you so much for joining us and really appreciate you taking time in your day. To that point, prior to opening back up, you kind of had an idea of a bunch of things that you thought were going to happen. Now that you're open, now that you're working with your patients, now that you're working with your team, what's real? And then what was just, stuff that kind of freaked you out that you kind of reacted to?
Well, thank you for having me again. This is great. This is in the middle of my day. I already saw 2 patients this morning already. So you caught me up early, ready to go. So we've been shut down since March 12th, but we really never left the office. Once we knew we were going to shut down, we already started taking precautions, knowing that it's going to be a challenge once we reopen. Personally, when I said we never shut down, we were here for emergencies on a very limited schedule, seeing patients, 1 or 2 patients a day. And we realized that we had to make some changes. Some of the guidelines that came from the ADA, but they weren't really strict guidelines. We had to do a lot of it on our own. So where do you want to start? The first thing that was important for us was air filters in the office. One of the first things we researched was different types of air filters in the office. There's one that you may hear running behind me in the corner there. We can mention names or not, but it's a residential air filter system that we bought. After researching them, we found out this one is more proven and it works best in our room. So we want to know that the air is being cleaned several times an hour because we are at most risk for airborne particles that are released from the aerosol procedures that we perform in the office. So let's talk about what's working. Yeah, I think everything is working. Everything is working. When we first started out, it was slow. Patients were coming in, but now we're back to a full busy schedule. We have 4 hygienists running full-time and 4 doctors running full-time. We extended our appointments to give everybody more time to get seated so there's less people gathering in the waiting rooms. And the rooms are sitting empty for 15 minutes after each appointment to make sure the air is clean. I think the biggest challenge was getting the staff on board and making sure the staff felt comfortable coming back to work, Rolando. That was the most important thing for us. We really take pride in building a big team here at One Manhattan Dental. So we communicated with them at least once a week through Zoom chats, similar to what we're doing now, to make sure that they didn't have any questions and they felt safe coming back. There are a lot of dentists that I spoke with and they lost staff due to COVID-19. Some of them moved out of the city. Some of them are just afraid to come back to the working environment. I really feel that we are working in a safe environment, and I'm very proud to say that our office is up to spec. It's also a brand new office. We got lucky and we did a full renovation prior to COVID-19, so that helps also.
Thank you. I appreciate that. And it's so cool that the things that you got, the context of airflow and do you see a big difference with regard to all of the PPE, all of the equipment that you put into the office with regard to the air quality in your office? Are you noticing it? Is it significant?
I don't notice a change in air quality. It's always been a clean environment. We have a lot of windows in the room, which I can open if I need to. But the air has always been cleaning here. I've always had an air filter in our office, in our waiting rooms. We just got a better version that's going to sift out these particles, these smaller particles, and do a better job cleaning the rooms. That's just one part of what we did. The second phase of what we did was to make a determination what do we need also chairside to help remove the airborne particles. More specifically, what we're creating with our handpieces, the aerosols from our dental handpiece or from the Cavitron that the hygienists use. So we looked at it and we researched both ends, and our choice was an extraoral device, which is a cone-shaped unit that sits in front of the patient's mouth, comes up about 6 inches in front of the mouth. And from looking at those, I found there was very little room to fit your drill in there, and your hand was blocking that, and it wouldn't really do a great effect for that. So then we looked at different intraoral devices, and we ended up with your product, with Zyris's Isolite, which Isolite's been around for a long time and something I probably should have had 10 years ago. It's not just for removing the aerosols. There's a lot of great uses for it, which we found. So every room is using the Zyris Isolite. The hygienists are using it for every treatment room, and the doctors are using it. What the patients love about it is that, and myself, because I've tried in my own mouth, is that one side is a bite block and allows the patient to bite down instead of forcing the mouth open. The most difficult part of a dental appointment is to have your mouth staying open for 45 minutes. This device allows them to bite down, and the other side of the device is retracting the cheek, the tongue, and the tiny little holes in the high-speed suction devices, eliminating most of the aerosol, most of the saliva. So it's controlling the splatter and the droplets. The splatter and the droplets is what's produced in the patient's mouth with our aerosol.
Well, thank you for that. Really appreciate.
No,
now,
not trying to plug your system. It's amazing though. It's really changed our practice.
Now, you mentioned that your hygienists also, they're all back. And it doesn't sound like there is any trepidation or there's minimal trepidation or fear. I'm going to use the word coming back. How did you get them there? Or what was that whole dialogue about? Because that continues to be a pretty heavy topic around with regard to others out there.
It's a good question. Just like I said earlier, the Zoom chats has really helped them. The communication that we built with our team took the fear away from them. When we purchased the Isolite and we set it up, we did a live Zoom with Zyris and then went over how to use it with our staff. And we had these weekly meetings with our staff, and we explained to them all the PPE equipment that we're gathering for them. They knew coming back to work we had enough gowns, we had enough N95 or KN95 masks. We had face shields, plenty of disposable equipment, and it's been coming in on a regular basis to keep up with the demand for it. So before everybody came to the office, they saw all this equipment. Before they saw any patients, we did a dry run. We had them all try on the equipment. We also increased the chair time. So the hygienist who had an hour to clean someone's mouth now had an hour and a half. They didn't need the whole hour and a half, but we wanted to make sure they had 15 minutes prior that room was sitting empty. And 15 minutes after for the next patient. There's a lot more forms to fill out. So that took a lot more time for each patient coming into the room. We have COVID-19 forms for everybody that they're filling out. New patients and existing patients are having their temperature taken before the visit. We have an oximeter reading to check their oxygen levels. Even if they have two visits in a row, if they come in on a Monday and they have a second appointment on a Tuesday, this is still routine. We're doing it on everyone. So the only complaint I think I got is the hygienists were tired at the end of the day from all the extra equipment. But now we're into this for about 6-7 weeks now, and it's almost, I'd like to say, it's almost back to normal.
That's cool. Almost back to normal. Holy cow. You know, it's when you look at all of the things that you're putting in place, you had to do research. I'd like to understand, during the course of your research, you discovered things before, and then you implemented. And I love the fact that you're basically synthesizing that information, and then you're applying it. And what was research that was validated? And then what were things that you discovered that seemed to be a big issue at the time, but now are not? Is there anything like that?
Well, my partner, Rob, it really helps out a lot with the research. I have him, and whatever I say, he'll look it up 3 times over and make sure it's perfect before we go to purchase an item. Well, the biggest research thing was the extraoral devices, that there was really nothing proven that they work. So I was really skeptical of ordering one of those extra oral devices. The Isolite has been proven for a while. It's been around for a while, and it works. And the same when we did the research on the air filtration system. We ended up with the molecule unit, which has a HEPA and a UV filter in it. It's mainly made for residential use. And the ones that we researched on the medical end weren't as proven and tested as to the degree that these molecule units were. You know, part of our research started speaking with different dental groups and different dentists on, what are you guys doing? What are you ordering? In the beginning, it was crazy. All these things, everything was being sold out. Everybody was just running to go buy this and go buy that without doing any research and making mistakes. You know, they're buying these big units and it's sitting in the corner of their room not being used. I like to say everything we're implemented, we're using every day.
That's cool. And you know, when you think about it, that's awesome that you took the time prior rather than just kind of knee jerk and kind of grabbing everything. Let me ask you this, and I don't know, there's a cost to all of this equipment. There's a cost associated with that. How has that affected how you're, you know, just how you're doing your business and what fees, that type of stuff?
There is a cost, but I look at it as we had no choice. You know, just like the renovation we did here, we made it as perfect to make it to serve our patients. We weren't cutting any corners because most of this is truly before the patient. It's my safety and my team's safety that comes first. And that's what most of these devices are doing. They're cleaning the air so it's safe for me and my team. It's not helping that patient that's in the chair. It's helping the next patient that comes into the room.
Right.
So when the patient sits in the chair, the first thing they're doing is they're rinsing with a peroxyl. Peroxyl is made by Colgate. It's I'm not sure the exact percentage, but it's a hydrogen peroxide, and they'll rinse for 30 seconds, and that'll disrupt the bacteria in the mouth. So after that, we'll start treatment, and that's not helping the patient. It's helping us. It's helping the air for the next patient.
It's amazing, and it looks like it's working. There's now, you know, there are things, there are studies, or at least information now coming out that although coronavirus cases are literally going through the roof in a lot of different states, not really seeing a lot coming out of the dental practice. How does that make you feel?
You know, I feel that dentists have always gone above and beyond to protect themselves. Going back to any of the earlier viruses, I mean, I don't know what went on in 1918 with the early viruses, but SARS and anything later, and even AIDS, originally when that came out, people were afraid to go to the dentist. They're going to get AIDS. Nothing's being transmitted from the dental office. I mean, I actually feel I'm as safe here as I am at home. But we still have those patients that aren't coming in yet, and you're going to get the nervous patients, and they're going to wait till there's a vaccine. It is the summer now, so a lot of our patients do take time off in the summer and out of the city anyway. So those patients aren't going to rush back. They're going to wait till September and October to come in. Just this morning, I had an emergency patient who called me and wants to come in, so I can come in any day as long as it's 8 o'clock in the morning. I want to be the first patient in the office. So I wasn't going to argue with her. I scheduled her. She'll be the first patient in the office. I had an opening, I think, Wednesday, and she's coming in Wednesday morning. So you're going to get that certain amount of fear that people are afraid to come here, that go into contact and come in contact with the virus, stepping outside the house. Now, these patients are the same patient that hasn't been to an outdoor cafe yet, hasn't been to a supermarket, and they're staying at home. So that type of fear, I understand it, and it's a lot with the elderly population. But it's really not affecting our business on a whole.
That is cool. I love the fact, and you're working with your patients, you're making the time for them, you're doing literally everything. You have, because as a prosthodontist, you're kind of a more of a specialist. How is the relationship, or what's the communication with some of your referring dentists? So what did you put in place for that, and how's that going?
Well, we did a lot of consulting with our referring dentists and let them know what we're doing and try to encourage them to take similar measures of what we're doing for their offices. And most of them have taken the same proper precautions and bought similar equipment that we have. Naturally, if the patients come into me, they're usually comfortable going to the specialist, and I make sure of that. I kind of vetted my specialist and make sure my patients are going to a clean office. I think that's really important to me. There's a lot of dentists that shut down because of this, that couldn't bring their office up to par, or they're older and they're concerned about getting sick themselves. So we got a lot of new unattached patients from either previous dentists who retired, or I just haven't opened their offices yet.
And the experience that they're having, do you find that there's a lot of apprehension, or do they tend to be less freaked?
Most of the referrals that I'm working with are on the same page that we are. Less freaked, trying to have meetings with their team and make sure the team is functioning properly. I think that's the biggest thing, is to make sure your team is on the same page, from our office manager to our assistants down to our hygienists. And I said we have weekly meetings with all of them just to check in with them, make sure they're okay. And, just a simple question. Is there anything we're doing wrong? Is there anything you'd like us to see doing better? Is there anything that's making you afraid to come to work? And just like this, how we're talking to you right now, our team watches all this stuff and they love it. They love that we're doing all of this. It's great stuff. It's really good.
That is so I'm curious, when you look at it, there have been a lot of clinicians who have a lot of apprehension because there's so much uncertainty. It seems like, it almost feels like, based on everything that you've done, you're almost one step ahead of the game. You were doing your research, you were jumping up ahead in front, you were validating things before you were buying them. Where did that come from? Was that just something that you guys came up with? How did you get into that kind of mindset?
I give Rob some credit for that. Rob, my partner's got some great leadership skills, and I think that's where we come together a lot. We've both done some business training together. We both have a coach that we share, that we have weekly calls with, and discuss all aspects of our business. Sometimes we discuss each other. So it really helps to collaborate with someone else and make this work. I'd like to think I could do it myself. I don't know if I could have. A lot of input came from my partner, and together we help create this environment to make it safe for our patients and our staff. I keep saying the staff because if they come first, ourselves and the staff come first, and then we create the great environment for our patients.
That is cool. That is so cool. So wait a minute. So Rob was on the show last week, and you guys have been you've known each other for quite a while. And then you recently ended up coming and working together. How's that going?
So I've been in this office practicing for about 12 years now. Rob and I are almost best friends. He's a few years younger than me. I'd like to
almost.
But we're like best friends. So we've been talking and collaborating for years, and there was an opportunity for him to come to this space. We redesigned and we rebuilt the whole space together. And we've been working on our business plan since then, trying to make this a better environment. You can see behind me, we branded ourselves. So once he came in here, we called ourselves One Manhattan Dental. And it's been a rock show since then. We love it.
And you guys, are you the same or different?
Yeah, that's where you're going.
That's where I'm going. Wait, what is it?
I don't know. Where are you going with that? The yin, the yang, you're trying to get out?
He completes you. Is that what it is?
Yeah, you got to say that. The Batman and Robin.
Well, no, because the dynamic is clearly,
that are probably complete opposite, but then there's part of us that are exactly the same. And the things we're at differences about, we discuss, and then we kind of find a happy medium, and it seems to always work. I think our coach is a big part of that. But we make all the decisions together. And that was one of the big things when we came together here, to have our teams on the same page so we function as one practice instead of two different dental offices under one roof. And that's the best part about this. We work together quite well.
That is cool. And thank you for that. I had to do that.
Because, that's okay. That's okay.
Now, it's interesting when you look at the business, the dynamic seems so positive, and there's a vibe that's going on. What do you attribute that to? Is it because the patients are coming back? Is there a feeling that you're kind of settled? I mean, New York was the epicenter for a lot of cases, and it seems to have settled out. What do you attribute that to?
We both love coming to work every day. We love taking care of our patients as best as we can. And it's fun when it's working and the patients are coming in. We're excited about it. We're excited about doing big cases, working with our patients, working with our team. I personally don't have any fear anymore. I'm protecting myself. I'm wearing all my gear. I'm using my isolite. I'm just reassuring my patients. Sometimes you can't be too casual because we get in a comfort zone and the patients coming in are still nervous. But we have a good way of relaxing them from the first second they walk in the door.
That's cool. If I were to ask you, because I'm hearing all the things that you've done, what if advice that you would give other clinicians for things that you would tell them not to do, what would some of those things be?
Obviously, don't panic. Main thing is to communicate with your team. Don't separate yourself from your team. Don't try to figure it all out yourself. You need to all work together and all be on the same page, because the patient will sense if there's any disarray or if you're not doing things right. So that's my take on this, is to work together with a team. And I have spoken to other dentists. Some of them too late. They already closed their offices. A lot of dentists came to us and had questions to us and where we were securing our devices. And, one thing that we bought was we wear these, we wear these crazy glasses with our light and our goggles, and they come out very far. And most of these disposable face shields were sitting too close, and they were working. I wasn't able to adjust my light or my magnification. So we designed these face shields that stick out quite a bit, and they allow us to still work without light, and they sit further away from our face. So that's something that we spoke about that, and we had dentists calling us on that. We helped this company design those. Now they're selling them on the internet, and it really works. So certain things like that really help. And there were certain things that I got information from other dentists. The isolite, I knew about that years ago, and I didn't realize it was wonderful it is. I thought it was just someone who didn't have a dental assistant and they wanted to use that instead. But you need both. You need the dental assistant with suction, and you need the isolite with the suction working at the same time.
Again, thank you for that. So the sentiment or the feeling that I get is, although you're taking this seriously, there's I feel a comfort, or not a comfort, wrong term. You recognize, and there's a sense of calm that's coming in the office, because, COVID is real, right?
COVID is real.
And it's, you got to be really careful. But I don't feel, especially between you, Dr. Sclafani, and Dr. Raimondi, I don't feel a sense of apprehension. I don't feel the anxiety that I've heard from other folks. Is it there, and you're just kind of holding it, or?
It's honestly, it's not there. We have no anxiety coming to work, and I feel patients feel the same way. They may have a little anxiety when they enter the office, but by the time they leave and they see what we've done here, they're much more relaxed, much calmer.
Yeah, and you seem to, and your team also seems to have that. Okay, this is good. We're coming in, and I think he mentioned you haven't lost any of your teammates. The doctors are there. Everyone is.
We actually hired, I think, 3 new employees since this. We've hired a new hygienist. We hired 2 new front desk employees. So I don't really think about it. There's no fear. When I think about it is when you're getting ready to put all your gear on, you're like, "Oop, I forgot my shield. Oops, I got this." So that's becoming more and more routine. Just like when you leave your house now, you grab your cell phone and you got to grab your face mask. It's another thing not to forget. So it's the same thing when we down and put our equipment on. You put your gowns on, you put your glove on, and it's becoming more routine. So in the beginning, you were forgetting to put maybe the face shield on, one of the assistants, but now it's becoming more routine for everybody.
Do you ever have any patients that refuse to maybe put on a mask, or are kind of resistant to you with regard to some of the screening that you're done? You hear all these horrible stories of patients who are like, "No way." Are you running into any of that?
Yeah, some people will come in and say, "Oh, I'm fine. I just had my temperature taken," and and we're still doing it anyway. But they'll come in the room. It's actually the opposite. Everybody comes in with a mask on. Some people are in the chair and they're still not taking their mask off. I said, I need to take the mask off and look at your teeth. But that's it. Again, they come in maybe a little apprehensive, but they leave on a better note.
Oh wow! I love the fact that there's so much consistency, and that you're literally going over the top with regard to the things that you're doing and the way that you're operating. So that's so cool. If you were to sit down and you were to kind of, and I ask this question because people are going to be watching this, clinicians, patients. What is the message that you'd like to give them with regard to, dentistry overall, and what do you want? What message you want to give them regarding going to the dentist?
Well, again, dentists have always gone above and beyond to do what's best for themselves and the patients. We've always had proper gear on, masks. We've always worn a level 3 mask to begin with. Now we're wearing N95 masks with another mask on top of that. I want everybody to feel safe. I want everybody to feel you're not going to come into the dental office and pick up a disease, an infection, a virus that you didn't already have. Personally myself, I've been getting tested once a week and getting results within 12 hours. I like to reassure my patients that I'm clean, and I reassure my staff and my family the same. But I don't think anybody needs to be fearful to come to the dentist. I think it's you're doing more wrong for yourself. A lot of people have missed their appointments. If you had a cleaning appointment in October and you were due in March, and we got shut down, so people have been almost a year without a cleaning, and that's doing more harm for your body.
That's cool.
It's good.
And from a team, or for what message do you give to your team, or what's the sentiment that you want to get out there with regard to kind of your perspective on what you're doing now and how you want to move forward with this?
Yeah, my team knows that I've been very clear from them since the shutdown with the communication. If they have any questions, we discuss them out in the open. They've also feeling that it's gotten much easier. They're a little hot at the end of the day and a little tired by wearing the disposable gowns. They're not afraid of treating patients. They're not concerned about getting sick. They have plenty of equipment to wear. Each assistant hygienist, they all have their own N95 masks, several of them that they can rotate, because these masks can be reused. So usually we let them breathe for a day and we rotate the masks that we're using. So my staff has been great since day one. Really no questions, and no concerns about their health at all.
That is cool. From your perspective, your personal perspective, COVID-19 is not going to go away, and there's probably going to be something else that may be coming out here. What's the approach, or what's the perspective that you have, and how do you see this playing out over time?
Yeah, I feel this is not the end of it. I think this is going to be around for a while. Even if we do come up with a vaccine, there will be those who will not want to take the shot or whatever there is for the vaccine. So I think we're going to be wearing the PPE equipment that we're wearing now for a while. There could be something else that comes back in a year or two that trumps this, that could be larger than this. We'll be prepared for it. I don't think there's anything else we could be doing now to be safer. So if things change and another virus comes about, we'll be doing the exact same thing.
Thank you. First of all, when I speak to you, when I speak to Dr. Rob, when I listen to what you're doing, I feel reassured, and I think part of that feeling, and that is what makes this so cool. There isn't an apprehension. You're right. People can sense or feel if you don't feel comfortable with it, and everything that I hear, everything that I feel from both there's a confidence, and I think that's important. I mean, you're the professional, you're the dentist, you're the ones going through it. As a patient, if I'm coming in and you don't have it down, and you all have it down, then I'm going to feel it. So I appreciate that. Thank you for that.
A lot of the patients knew also before we opened. We sent out a lot of emails just to communicate with our patients and let them know what we will implement in the office to make them feel safe. From the temperature taken to the filters, to the isolites, to the new gowns, to the masks, the plexiglass that we had installed at the front desk. I had an art gallery make this beautiful plexiglass that you can hardly see to separate the front desk from the patients. So there's no contact. Everybody behind the front desk is wearing masks. And the patients already knew all this before coming into the office. So they expected it. They came in with less fear and less worry.
No surprises. Right?
Everybody still has some concerns and fears, and there's probably still people that won't come back till we have a vaccine. But the majority of our people knew in advance that we created this environment for them, and we're still going forward. Anything new that comes up, we'll research it and implement it if needed.
That is cool. I have to say, I love the fact that you all are connected. Look at that.
Oh,
I love it.
I love you writing in there. It's great. Couldn't do it without you.
If you had, or if somebody had a question for you, what would be the best way to contact you or to send you a message?
Best way to contact me is probably through my Instagram, which is Dr. Sclafani, Sclafani, or you can reach us through One Manhattan Dental. And I'm here. I'd love to share anything we've done with any doctors or patients who have any questions about any of this.
Absolutely. And I would encourage people because it seems you've worked through so many things and things are working for you and things are in place and they are working. I think that would be great. You know what? A couple months from now, I'd love to have both of you together. Would that be something that you'd be willing to join and kind of hear how things are going and that type of stuff? What final words would you like to kind of give to your viewers and the folks that are listening to us today?
Well, thank you for listening, whoever's there today. Please don't have any fear. Any dentists are out there, you should be taking care of your patients just like you have throughout your career. Patients, don't pass on your health. Make sure you take care of your teeth, just like the rest of your body. You're going to be fine. We're all going to get through this together.
Awesome. Well, first of all, thank you so much for joining us.
Thank you. Yeah.
We really appreciate it. Those of you who are watching this or are going to be watching this, if you like this content, please share. If you want to reach out to either Dr. Marc Sclafani or Dr. Robert Raymundi at One Manhattan Dental, please go check them out. There's so many things that they put in place, and it's really cool, and you can learn from that. Dental Voice is here. If you have any questions, please let us know. So grateful that you're taking the time with us, especially in the middle of your day. Please have a great rest of your week. Thank you for joining us, and I really look forward to connecting with you guys later and seeing how things are going.
Great. Thank you very much, everyone. Thank you for listening.
All right. Take care. Thank you.
Rolando. Thank you.